Hi there. Thanks everybody for your time and attention. I'm Sarah Chandler. I'm the director of the Bureau of Planning and Operations at the Medical Devices Directorate. My team, as well as members of the Bureau of Licensing Services Division within the Bureau of Licensing Services, rather, within the Medical Devices Directorate, work with Irina's team on the implementation of REP. So I'm going to start going through some of your questions. We've received a lot, so we'll get through as many as we can today. The first question, we've received several questions about whether this webinar is being recorded and if the presentation slides will be made available after the session. Yes, recordings from these webinars will be made available after this week's session. All participants will receive an email with information on how to access the recordings. As well, a copy of the presentation slides was included in the invitation for today's session. But if you do need further assistance in locating the recordings and or the presentation slides, please send an email to Device Licensing and we'll help you out with that. The next question, is the REP mandatory for medical devices? It isn't yet, but REP will be mandatory for all medical device license applications following the 18-month voluntary use phase, which we're currently in, and that began on July 31st, 2024. So the mandatory date will be approximately January 2026. So during this voluntary phase, you can continue using the existing PDF forms. However, they will no longer be accepted as of the end of the voluntary phase and the start of the mandatory phase. We also have received several questions about existing manufacturers and whether they need to complete CO and or DO request forms. Existing manufacturers can request a copy of their CO, as well as a list of their corresponding dossier IDs by submitting an email to Device Licensing with the subject line MD REP CO request and the company ID number, your existing company ID number. And this will provide you with the respective company contact and dossier IDs required for your subsequent submissions using REP. We've also received numerous questions about how to obtain the REP guidance document. The REP guidance document is currently available upon request by submitting an email to the no reply e-review email address. And please ensure that the text request for REP guidance document for medical devices is in the subject line of the email, and then the guidance document will be sent to you. We are also in the process of making this guidance document available online, like our other guidance documents. So we're still working through that. Next question. If we already have a CESG account and a company ID for pharmaceuticals or biologics, do we proceed directly to applying for a dossier ID? The answer is yes. Company and dossier IDs are unique for each product line, so you would need to apply for a medical device specific company, contact, and dossier IDs. What is the relationship between REP and the eStar template, and will the eStar template be used for submissions in future? So eStar is a submission builder for TOC content that we've been piloting the use of eStar. While REP is a web form replacing elements of the application form. So while they can be related, one isn't dependent on the other. The next question, is REP only for new submissions? The answer to that one is no. REP can currently be used for new and amendment medical device license applications, minor changes, or faxbacks, new and amendment private label medical device license applications for class 2s, 3s, and 4s. So essentially all of our license application types. The next question, we are importers of medical devices. Do we need manufacturer ID, etc.? Do I still need to fill the CO file to get A regulatory company and contact ID? The answer to that one is any third party involved in the application process for a medical device license, such as a regulatory correspondent or billing contact, will be required to submit a CO in order to obtain their corresponding company and contact IDs to be used during the submission process. Importers who are not involved in the MDL and the medical device license application process are not required to obtain a CO for the purposes of REP. Once a submission for a given license has been submitted through REP, is there any requirement that subsequent regulatory activities for that license continue to be submitted through REP as well? The answer is yes to that one. Once submitted through REP, all subsequent regulatory activities for that medical device license should also be submitted through REP. Will the IMDRF, the IMDRF folder structure be available to download? The TOC folder structure and guidance can be found under the guidance documents section of the Health Canada medical devices website. We are also looking at updating this information in the coming months. We have received questions about the processing times for requesting dossier IDs. So due to the transition to voluntary use for REP, we're experiencing a bit of an uptick in incoming requests. Our team is adjusting to this increased volume and will adjust accordingly to minimize any further delays. Please do follow up with device licensing if you have any outstanding requests and you haven't received a response within 2 weeks' time. The AI template indicates that the declaration of conformity is mandatory and the application cannot be processed without the declaration of conformity. This is a change from the currently published guidance. Does Health Canada intend to make DOCs mandatory for medical devices, class 3s and 4s? So thank you for flagging this concern. We are aware that there may be some discrepancies with the requirements in the AI template and the posted guidance and are looking into the matter to ensure that they are consistent with one another and that there is no conflicting information. But the intention is not to make the DOC mandatory. It is optional. So we'll work through that. All right, moving on. Is a dossier ID the same as our old application IDs? So if we need to submit an amendment, would we use that prior application ID as our dossier ID? So no, application IDs will continue to exist and retain their existing meaning. So please use the dossier ID request form to obtain the dossier ID for your license prior to submissions. As mentioned previously, you can also send an email to device licensing with the subject MDD-DO request and your company ID to ask for a list of your current dossier IDs. The next question is REP required for medical device establishment licenses? For all questions related to MDELs, including MDEL renewal, please reach out to the Medical Device Establishment Licensing Group. However, I can confirm at this time, REP is not required for MDELs. Can our company submit all the licenses to receive all the dossier IDs because it's based on license level? So if this is in reference to existing licenses, then as mentioned previously, all existing dossier IDs can be requested by emailing device licensing. Any requests for new dossier IDs will need to be done on an individual basis. Is there a waiting time for the dossier ID or is it assigned automatically after submitting the RT template? Unfortunately, dossier IDs are not automatically assigned and need to be obtained prior to RT submissions. The waiting time is about 7 business days. However, as mentioned, there may be some delays based on existing backlogs. Do we need to request dossier IDs for existing medical device licenses, or can it be requested when there is an amendment? Dossier IDs can be requested at any time prior to submission of a new or amendment application. You can request a list of your existing dossier IDs by emailing device licensing. What if the company is new and foreign in Europe? Do they need a company ID? The answer is yes. Any party involved in the application process for a medical device license will require a company and contact IDs. And I'll turn it over to Irina and team for the next few questions.
Okay, thank you. So the question is, can you have multiple gateway accounts for a company? So answer is yes. It is actually required because you are using your certificates. So there should be every user or every account should have only one user. When are we migrating to FDA Next Gen? So now FDA is conducting the third wave of the pilot, and that one is scheduled to finish November 22nd. Then there's going to be 2 to 3 weeks of going through the issues and findings. And currently the production date is sometimes between January and March 2025, but this date will be announced either before Christmas or shortly after Christmas by FDA, not by us, by FDA. Then the third question, can the save draft XML file be edited? So I assume this is regarding save draft XML, like the working copy, because after you generate the XML, it's final. But yes, if you haven't sent it to Health Canada yet, regardless if it's a working copy with the extension HCSC or you finalized it, yes, you can still go back and open it in the template in the browser, and you can generate a new XML file. Yes, and that's for all. It's company, RT, or the AI. Okay. I think now that's back to you, Sarah.
There's just one more. Is a CESG account required if you already have an MDL and a company ID?
Yes, so the gateway account is still required because it's a different system, and yes, you need a gateway account because again, it's a secure transmission of submissions to Health Canada or any of the FDA centers, and you need to create your certificates. And based on that, you can send submissions through the gateway. Yeah.
Perfect, thank you. So a few more from me. We only have a minute left, so I'll try and fly through. If our company has a company ID but never did submissions through the gateway process, are they still required to fill out the CO template? So they can either fill out the CO template or request their existing CO XML from device licensing. The CO XML will give information needed for the rest of the application process. How long does it take to receive the CO templates from Health Canada when requested via email? The target time is 7 business days. However, there may be some delays due to backlog. Can a contact identifier be assigned a group mailbox email address as opposed to an individual? A contact can be assigned a generic email address. However, the contact must be an individual and not a generic entity, i.e. it cannot be the regulatory team as the company contact. And I think we'll do one more. Will the final XML document be sent to all contact representatives entered in the CO template, or just the person that sent the initial email for a license amendment, for example? The final XML document will be sent to the person that sent the email requesting a copy of the CO XML or submitting a CO template. So that brings us to the end of our session today. Thanks very much, everybody, again, for your attention and for all of your interest. We can tell by all the questions that you've had that you're eager to learn how to use this new process. So if you do have future questions, please feel free to email us at the device licensing inbox and we'll get you some responses. Thanks again. Take care.